Okay, so this is our case 3 team presentation for group 11B with Priya, Matt, myself, and Kimberly. So we'll start with the quote, "We take belonging as our starting point because a problem of unbelonging demands it." This is in the article Towards Radical Belonging, Envisioning Anti-Racial Learning Communities, where the authors defined radical belonging and used it as a guide to create a true and genuine anti-racial learning environment. Key to using radical belongings, they titled "The Requirement of Transformative Change to Root Out Problems," understanding that the experience of the individual is created by the collective action. This means that all stakeholders should have the opportunity to weigh in on identifying problems, finding solutions, and being part of the enforcing change because they're all going to be the ones that experience it. They also stated to do these things, we needed 3 essential concepts that enable and support each other, and must be kept in mind. First is social belonging, or ensuring that not only does the individual feel supported and seen, but that they see others also see supported and seen in the same way and at the same level. Also, in this context of an elementary school, they cited academic belonging, which means you can't just have someone feel safe and welcome, but not give them the same opportunities for growth as others. And lastly, democratic belonging, where all the stakeholders should be able and willing to be introspective of the current practices and apply new and changing ideas. So taking this breakdown, we, as well as our own opinions that we've all made through our experiences in our field, we made our own definition. So our definition of radical belonging is when all people in an institution feel as seen, understood, and supported as those around them, regardless of position or service. This must become an essential part of the organization's culture as a whole, and not just a supplemental or temporary program on the side. And in order to maintain that, the organization itself needs to have a system in place that allows all stakeholders to work collaboratively, to be introspective about current practices, identify sources of new problems, and implement changes in a way that keeps this supportive and inclusive culture. So why does belonging matter in healthcare? Well, in the United States, people in healthcare are expected to give above and beyond care in a field where there are obvious inequalities in resources, support, and access. And this can lead them often feeling overwhelmed and helpless and drained. Add to this an unfortunate life event, a natural disaster, or a pandemic that's out of their control, and these feelings can be exacerbated. When institutions are not fostering spaces that welcome these workers and their struggles and help support them, but instead add to them, that will lead workers to feel unseen, unsupported, unappreciated, and alone. And this is what leads to burnout. Now, in the 5 cases that we'll present to you, you'll see that oftentimes a singular problem can be exacerbated by an unsupportive and oftentimes oppressive environment. And if the workers are not supported for long enough, that's ultimately when they begin to leave, and it'll affect the new workforce as well. So the 5 characters that we have are Chandra, a family med doctor experiencing a classic case of burnout during the pandemic. She lost touch with her own beliefs, and she no longer feels safe or significant in her work environment. So her need is a workplace that focuses on long-term sustainable burnout prevention. Next, we have Sarah, a single nurse struggling with childcare and is not feeling very supported and during the pandemic. This leads her to feel underappreciated and underpaid. What she needs is a workplace with flexible and adaptable policies, and a workplace that trains and empowers their supervisors to make more individual calls. She could also benefit from more pay.
And then next we have Jessie, a nursing home aide who feels underpaid and micromanaged in a hostile work environment where she hears racist and homophobic remarks at work. So her need here is a welcoming workplace that acknowledges and compensates for work and for extra skills. So in her case, she was bilingual, so acknowledging that and compensating appropriately. Then we have Jonas, an environmental service worker who wants an environment that allows for more growth as he currently feels underappreciated and underpaid. So their need here is a workplace that offers training programs, on-site training and certifications, and other opportunities to grow within the company. And then lastly, we have Andrea, a healthcare administrator who's frustrated with having to focus on COVID-19 related problems rather than work towards bettering the healthcare system by addressing long-term systemic issues. She feels she is not making a significant impact on the healthcare system. So her need here is a workplace that hires personnel to handle specific problems related to COVID and not using others, adding more duties for less pay. So what are the main issues at hand here? In this case, we had 5 employees, all from different ethnic, racial, and educational backgrounds, experiencing the everyday hardships work life brings with the COVID-19 pandemic, adding a thicker layer of distress. So they're feeling all the things of burnout, hostile work environments, their moral compass that's in question daily, underappreciation, micromanagement, and narrow focus on COVID problems instead of healthcare issues at large. So with that all being said, our proposal is what goes next.
So we wanted to have something that would be kind of a cohesive unit to take care of these problems. So we are proposing to create a committee to focus on the well-being and radical belonging of the employees. And a big part of this is that we want all of the members of the committee to be paid for their time, whether they're taking time out of their usual job or they're hired separately for this, they need to be compensated. And we want each member to represent a major discipline in the hospital, including those people not directly related to patient care. Our goal for the committee is to incorporate wellness of the employees into the organization's mission statement and create policies and procedures to support radical belonging for long-term sustainable change. And the committee will focus on employee mental health, retaining employees, supporting employee growth and progress, and creating a desirable work environment for hiring new employees. And since we want this committee to last long-term, we want it to be adjustable, adaptable, and flexible as the hospital grows and runs into new situations and changes. And so the organizational actions of the committee will include to implement listening sessions, suggestion boxes, and employee satisfaction surveys so that they can get an idea of the hospital-wide perspective of what are the problems, what can be changed, what are people currently struggling with, just so that they'll always get the employee perspective. We want them to separate paid time off into sick days and vacation days with no penalization for using that time, just so that patients or employees are not using up all of their time off when they're sick. We want to provide training programs and educational opportunities to facilitate staff growth within the company, as well as restructuring advancement opportunities as able to not require a specific degree and instead of taking experience. We want pay raises for any underpaid staff, as well as bonus pay for any extra skills that someone might have. We want tuition and student debt repayment contracts to help staff better their career. We want a child care center in the hospital to prevent any staff missing work or being late because of their child care responsibilities. We want to provide incentives for participation in surveys and listening sessions so that we make sure we get the most amount of people participating as possible, as well as we want support groups and an on-site therapist to support all employees' mental health. On the team level, we want to implement daily team meetings so that the entire team is on the same page in regards to any changes happening or any patient care. We want to hire extra staff when needed to keep patient to employee ratio low and cover breaks and shift changes so that we have good patient care, and this would prevent burnout as well. We want extra training for team leaders such as managers on radical belonging and what they can do to support their team. And we wanted to ensure each team member is working within their scope of practice and are not being pushed to do anything extra outside of their job title. On the individual level, we really want people to take advantage of the opportunities provided by the committee, including the mental health support, attending the listening sessions, taking the job satisfaction surveys, taking advantage of any other opportunities, and even applying to join the committee if they're able, and also just to communicate what their personal needs are to the committee.
All right, so next we were posed with the question of how COVID-19 has an impact on marginalized communities. So through our recommendations and our interventions take into account all employees and their needs, from mental health, physical health, appreciation, flexibility, and extra resources. Our committees will include employees from every specialty, such as medical doctors, PAs, nursing, medical assistants, physical therapists, occupational therapists, social work, and housekeeping. And within these individuals, they'll represent all backgrounds and walks of life to ensure every community needs are being met. So COVID-19 has shown us that it affects different people in a variety of ways and severity. Therefore, our treatment plans cannot be a one-size-fits-all approach. So our interventions bring awareness to how COVID-19 affects people of marginalized communities due to outside factors outside of their control. So with this in mind, we can approach every patient with mindfulness and intention, listening to what they need to bounce back from the effects of COVID-19. Next, we have COVID-19 has shown to be detrimental to the overall well-being of all healthcare workers in insurmountable ways. They've been kept from their families. They've had to stay home with their sick children, which has resulted in not getting paid, or they've had to have their child in childcare, which those expenses has risen, or their lack of childcare, and then burnout with everything of these. So within our interventions, as having like a childcare in the hospital setting, it leads to employees not feeling or they're feeling more appreciative and taken care of, so they're not missing work and they're getting paid and everything of that sort. So with our interventions, it leads to more employee retention, so that the COVID-19 effects are taken into consideration within these marginalized communities.
Sorry. So first, how do we get started, or the steps to implement this? In the spirit of democratic belonging, we want to make sure that all shareholders have a say in building this committee. And we can achieve this by first identifying who those stakeholders are, which are going to be those affected by it, the patients, the staff, the support staff. And we also have to make sure that we understand what barriers or obstacles would be in the way to start this committee. Once we do that, we also want to get into the collecting data or input on what those stakeholders would like to see from this committee. And we can do that via Google surveys, patient surveys, staff suggestions. Once we're able to get enough data about what others would like to see from this community as well, we can create responsibilities and duties that then we can create a job posting. As mentioned before, we would want to make sure that we hire committee members for this. We don't really want to focus or rely on volunteer service when there are a lot of when there are positions that require full commitment to those positions. So we still want to include people from different backgrounds and experiences, but we want to make sure that they have the time and are compensated well to have a vested interest and commitment to the goals of the committee. It can include current staff, but then they would have to be able to have enough time allotted for both jobs. So the committee duties would break down to, they would choose the frequency of these listening sessions. We recommended 2 per month, but it can be as needed when there are other things that happen, like when COVID-19 happened. We would also want to make sure that Google surveys, patient surveys, and suggestion drop-offs are available 24/7. We can also encourage participation by possible incentives to participate in the studies. We can also make them available on the end of newsletters or on websites. They should also meet twice a month to analyze the submissions and then create attack plans. And once they're able to come up with some solutions, they can present these solutions at listening sessions or make them available on a website or a newsletter for full transparency so that everyone can see what the ideas are. They should also have meetings with representatives of the departments needed to implement change. So if one of the bigger issues are people saying they need like a pay raise, then we would involve payroll and human resources to kind of work that out. Or if we're going to start working on childcare, then it would be maybe meeting with human resources, security, and staffing. They should also hold monthly meetings to evaluate how the current policies are working and be introspective on whether or not those need changes as well. So once the committee is created, and various methods are made to collect data, that's when change can happen. So if this committee were available for any of the people of the 5 cases that we mentioned earlier, then these are some of the goals that would then be created and implemented. As we mentioned before, this committee could then focus on getting pay raises for underpaid staff. They could also focus on training programs and educational opportunities to facilitate staff growth within the company. We also mentioned tuition and student debt repayment contracts, separating PTO into sick days and vacation days so that when there are needs for that, we're able to address it right away. Childcare centers and hospitals, and as we mentioned, support groups and on-site therapists.
So for the financial impact of this committee, we did not know what the immediate financial cost of this would be, but we just wanted to emphasize that even though it may cost more money in the short term, it will save money in the long term through retaining employees. As you can see from this quote here, that it is more expensive to hire new employees than to keep the employees that you have. So our goal would just be to save money in that long term.
So how do we measure success? We want to see both qualitative and quantitative success measures to see purpose for, need for, and then efficiency of the committee. Qualitative will be done through making sure that this committee is permanent so that they can have rigorous checkups on survey results and then adjust interventions as needed. Monthly listening sessions will address old issues and new issues, and then monthly and yearly Google Forms and interviews with staff will get staff feedback about whether how they feel about the programs and more. The survey will also be available for patients to fill out to get some more of that patient input as well. For quantitative measures, participation rates, staff satisfaction rates via these forms, and then also data collected from HR, such as employee retention rates, hiring rates, 1-year retention rates, workplace injuries, and patient injury rates, just to see the impact on overall patient care and to see if our programs are making a difference. We want to make sure that the interventions that we put in are both sustainable and scalable. As we kind of talked about before, we want to make sure that this committee is permanent for the long-term sustainability of it. To do so, we want to see that after 6 months that there is a permanent funding source built into the hospital's budget to maintain this committee. Further interventions by the committee will be based on evidence-based practice. And then for long-term goals also, involving key stakeholders and department representatives to increase participation. For scalability, the committee will have yearly reports that can be that other organizations can take and use in their locations. But I think the main point is that this committee exists without a specialist. It uses people within the organization and the community and patients that have a vested interest in improving staff well-being and thus patient care. So this can be easily taken to different organizations and especially organizations with fewer resources. A couple of goals that the committee has that can easily be transferred are the listening sessions, separating PTO time, and then establishing educational opportunities.
So for the effects on patient care, we found this study by Liu et al. In 2018 that showed that a positive work environment had a very positive effect on job satisfaction, which then led to those nurses providing better patient care services and getting better patient outcomes. So basically just that satisfied employees lead to good patient care and satisfied patients, and that the creation of this committee will lead to improved well-being and a sense of belonging with all of their employees, as well as patients are aware of when they're getting good care or not, and then through word of mouth, they will spread to other people in the community, and we will have more patients coming to our hospital.
Just to sum everything up, effective teamwork leads to ease in following processes and smooth systems. With well-designed systems in place, there should be fewer gaps in care, which lead to improved patient outcomes. When these systems are in place, when unprecedented situations happen, such as COVID or flooding or something, workers feel well supported and also allow for normal operations to continue while supporting all the workers and patients. A sense of belonging makes people feel a part of the team. This leads to people being recognized and appreciated for their work, putting in effort because they see their work is well compensated, respected, and valued. They see that other people around them are being supported as well. And this just leads to better trust in each other and the organization.
So for final thoughts, for myself as a med student, what I learned through working with this case is that it's important to ask people how they identify themselves and what they value in order to create solutions that best support them. I think that people need to truly feel understood and seen in order to then feel safe. I think also what I may think is the biggest issue for workers at the institutions I'm at are actually maybe different from others. And I also learned that every big idea, like a hired company, takes so many smaller steps to achieve. What I learned through working with this team is that coordinating across different schedules is difficult to do, but with communication, we're able to do it well. And then understanding and respecting that everyone has different ways of working is important. What matters most is communication and commitment to a common goal. What I take away from this is that my role as a future physician is that I don't really want to be a worker that just follows an established policy. I want to work in an environment that welcomes my ideas and my opinions to be able to contribute to an inclusive and supportive work environment.
What I learned through this case as a nursing student is that people's identities and needs are multifaceted, which is why it's even more important to ask and listen to people when they talk about their identities, their needs, and what they feel will help them succeed and feel valued. When planning interventions for these people, it's important to go into the community and really listen and learn. Handing down interventions from an ivory tower doesn't lead to the best possible outcomes. What I learned through working with this team is truly listening, understanding the different scopes of practice, abilities, resources, prior experience, and personal background that people have leads to just more ideas and overall better outcomes. Diversity in jobs and roles is needed is needed as representation in such committees to accurately reflect both the staff and the patients that the organization is serving. Finally, a great plan will never be successful without proper buy-in from all members of the group and communication. That kind of flows into my role as a future nurse. I want to be in an environment that values feedback and opinions. I hope to work in and create a diverse and inclusive environment and work to improve workplace culture overall. When working with others, I now much better understand scope of practice and what other roles can bring to the table and just how to treat the patient as a whole, the career personalis model. And finally, communicate, communicate, communicate.
So I learned that through this case how valuable it is to make sure all your employees feel welcome, safe, and valued, and that the sense of belonging and feeling valued leads to better patient care, better patient outcomes. And it also really highlighted what I want to look for in environments for any of my future jobs. I also learned that each profession has a slightly different viewpoint on any issue, and that's why it's so important to have a wide range of professions involved in any initiative like this, as well as any patient care problem, and that communication is just really important in every situation. And for my role as a future PT is to ensure that I'm communicating well with other health professions that I'm collaborating with to ensure my patients get the best care possible. And I want to speak up when I see something that can improve the sense of radical belonging in my workplace. And I want to be able to do anything that I can to help improve my workplace culture, whether that's participating in the surveys or being on a committee like this one, just to make sure I'm in the best environment possible.
And then my thoughts as a PA student through this case, I've learned that every person has something unique to contribute. So it's vital for every person to walk into a workplace feeling valued, welcomed, and appreciated. So with all of these things in mind, it does create a sense of radical belonging, which long-term leads to employee retention. And then what I learned working with this team is listening, understanding each person's point of view is important in achieving something great. And that is where real change comes from. And then my role as a future PA is that listening to every colleague is important because I may miss something that someone else sees and which ultimately could save a patient's life. And then obviously communication is key in making sure that is implemented for real sustainable change. And then lastly, adversity will be present every day. So having the mindset by welcoming that as a way for growth and change, and it does lead to an efficient workplace and decreasing the feelings of burnout and compassion fatigue that leads to detrimental effects on our patients and coworkers. So ultimately, just having the mindset of adversity can lead to greater outcomes instead of a negative effect.
And with that, that brings our presentation to a close, and we appreciate your time.